Good morning. Thank you, everyone, for attending. My name is Clark Kelso. I'm the federal receiver in charge of prison medical care. We're here today to talk about legislation to provide taxpayer relief from the high cost of prison health care in California. Obviously, my primary responsibility is to bring the quality of care up to constitutional levels in accordance with court orders. But I am keenly aware, as are the courts, that every dollar that we can save in the prison health care program is a dollar that can be spent on other important priorities for the state, such as education, money for children, for the elderly, for other health care programs. And I am in agreement with those who say that the state needs to get out of federal receivership as soon as possible. I'm in the unusual position of working myself out of a job as quickly as I can. That's why I think it is important to build bridges of cooperation between the federal courts and the receivership and the state legislature and the governor's administration. If a frustrated public has told us all anything in recent years, it's that they want us to do prison health care in a way that gives taxpayers relief from high costs. And that is why I am pleased to welcome you here today. The legislators who are here with us are working diligently to ensure that cost-effective solutions that we know work, are put in place and made permanent with the goal of fixing prison health care once and for all. They insist on providing taxpayers relief from the high costs of prison health care, and they are offering solutions that we know work and that we know we can implement. Most of the solutions we've already begun to implement, and they are yielding real results in the current budget year and will yield larger results in the coming budget year. I think these legislators understand that it would be a real tragedy for us to have gone through all of the work and the expense that we've done to improve care, only to have things slip back to the way they once were. And so each of these legislators is here today to introduce their bills, which are part of an overall legislative package to relieve taxpayers from the high costs of inmate health care. First, I'd like to welcome Senator Mark Leno, who's chair of the Senate Public Safety Committee and author of SB 1399, dealing with the medical transfer of inmates rendered harmless. Senator Leno.
Good morning, everyone. It's a real pleasure to be here with my Assembly colleagues and with Receiver Kelso to talk to you about our SB 1399 medical parole. You know, when I first took on the chairmanship of the Assembly Committee on Public Safety back in 2003, I did some research with our staff, and we found that the state of California spent a greater amount of its general fund, percentage-wise, than any other state in the country. And at that time, we were spending 5.3% of our general fund on corrections. Today, we're pushing 11%. That's over just the past 7 years. And the greatest driver of that increase of spending in corrections is healthcare costs. And the biggest component of that increase in healthcare costs is known as outside specialty care. Just 1% of outside specialty care visits makes up a third, 33% of that outside specialty care. So how we're going to deal with this ever-escalating cost is through medical parole. Now, who would be eligible for medical parole? There would be a two-step process. First, the secretary of the department or the board of parole hearings would make a determination that an inmate is medically, physically incapacitated, and the second step is that inmate is of no threat to public safety. Now, who would be in the pool for that consideration? Again, this is just authorizing legislation. This doesn't let a soul out of prison. It gives this authority to the secretary of the department and to the parole board. Excluded from this pool would be anyone sentenced to death, sentenced to life without parole, or anyone in prison on a third strike. So again, we just want to follow the good practices and successful practices of 36 other states. The state leading the way on this medical parole idea is the state of Texas. And I've always said what's good enough for Texas is good enough for California. They are moving about 100 to 170 inmates per year into medical parole. Now, you're probably familiar that we've dealt with this issue of medically incapacitated inmates before under a compassionate release program. This is significantly different and will have much greater savings in that we will, through this, keep these individuals on parole, so there is greater addressing the issue of public safety. So at any time, the parole board or the secretary could deem someone to be a risk to the public and pull them back into prison, conditions of parole. Or if their medical condition improves and they could conceivably be of any threat to public safety, again, their parole can be revoked. And again, there can be conditions put on the parole as well. Most likely, minimally, there would be electronic monitoring of these inmates. So then they would be paroled to a medical facility, mental health facility, hospice, long-term care, whatever the department approves. And the savings could be significant. The receiver has told me that we have approximately 1,300 inmates who are costing the state over $100,000 per year in medical costs. Some of them as much as $500,000, $1 million, in one case even $2 million a year. And because they would be in an unlocked facility, there would be the savings for the security costs, and most significantly, because they would be in an unlocked facility, they would be eligible for SSI, Medicare, or Medi-Cal. So we would have the federal government pick up the costs, as opposed to the compassionate release, which puts this on the back of counties who have to care for their health care costs. These costs would be picked up by the federal government. And I just wanted to, oh, then, of course, not to be overlooked, we'll be freeing up a bed, which is needed for someone who is indeed a risk to public safety, a bed that we currently do not have. I just wanted to share with you a couple of examples of who we're talking about. A male in his 50s with end-stage lung disease, on a ventilator, unable to exist off the ventilator, needs 24-hour nursing care at the long-term acute hospital level, accrued over $500,000 in costs in the last 18 months. Again, incapable of talking, swallowing, moving, bladder control, eating, very little apparent cognitive functioning. That's just one example. Even more expensive individual, a male in his 60s, has end-stage cardiac disease, diabetes, hypertension, gangrenous legs, poor circulation, multiple cardiac arrests, very long lengths of stay in hospitals, too weak to exist out of a skilled nursing setting, has accrued over $1 million per year and a total cost of close to $2 million, could be paroled to a skilled nursing facility. He's not capable of independent activity, movement, very cognitively impaired. So I think you get the idea. We are housing and paying the cost for some very seriously ill, completely incapacitated inmates at huge cost to the taxpayer. And I'll just close by saying, we as legislators, along with the governor, have some very difficult choices up ahead. This year in particular, we recognize that there won't be any Republicans interested in risking their political careers to do what we think is right, which is to find some revenue. So that's not an option. And every accounting trick has already been used. We're really going to face some of the toughest decisions this year. I, for one, would much rather save the jobs of 35 teachers rather than continue to incarcerate 10 comatose inmates at $250,000 a year. Multiply that by 100, and I think you get the scope of the situation. So I'm very pleased to work with the receiver on this bill, and I hope that we'll have success with it in the legislature. Thank you.